Are Adderall and Focalin the same? Adderall and Focalin are both stimulant medications used in the treatment of Attention Deficit Hyperactivity Disorder, ADHD, but they are not the same. Each contains different active ingredients and belongs to slightly different classes of stimulants, which affects their mechanism of action, potential side effects, and efficacy in treating ADHD symptoms. Active ingredients. Adderall contains a combination of amphetamine salts, specifically dextroamphetamine and levoamphetamine. This mix acts by increasing the release of neurotransmitters like dopamine and norepinephrine in the brain, which helps in improving attention and reducing impulsivity and hyperactivity in individuals with ADHD. Focalin, dexmethylphenidate, is a refined form of methylphenidate. It is the active d-enantiomer of methylphenidate, which means it is a more targeted form that can offer similar benefits at lower doses. Methylphenidate, the parent compound, works by blocking the reuptake of dopamine and norepinephrine, increasing their levels in the brain. Mechanism of action. Both medications increase the levels of dopamine and norepinephrine in the brain, but they do so in slightly different ways. Adderall increases the release of these neurotransmitters, whereas Focalin primarily blocks the reuptake, making more of these chemicals available to stimulate the brain. Formulations and duration of action. Adderall is available in both immediate release (IR) forms, which typically last about 4 to 6 hours, and extended release (XR) forms, which can last about 10 to 12 hours. Focalin is also available in immediate release forms, lasting about 4 to 6 hours, and extended release (XR) forms, which can last up to 12 hours. Side effects and potential for abuse. Both medications have similar side effects, including potential for insomnia, decreased appetite, weight loss, and increase in heart rate and blood pressure. Due to their stimulant properties, both Adderall and Focalin have a potential for abuse and dependence and are classified as Schedule II controlled substances in the United States. Choosing between Adderall and Focalin. The choice between Adderall and Focalin will depend on several factors, including the individual's response to medication, history of side effects, and the specific symptoms of ADHD that need to be managed. Some individuals may respond better to one medication over the other. A healthcare provider will consider all these factors when making a recommendation. In summary, while Adderall and Focalin are both effective in treating ADHD, they are not the same medication. They contain different active ingredients and have some differences in their action on the brain, which may influence their efficacy and side effects in treating ADHD symptoms.